Hello, and welcome to our fourth Spectrum Health School Health virtual series. I'm Leanne Moriello, Director of Lifestyle Medicine at Spectrum Health. In this series, we're connecting you with community experts to answer the questions that are most important to you and your family regarding COVID-19 in the back-to-school season, whether that's in person or virtual. And tonight we'll be focused on staying healthy and well this school season and how to keep your family healthy and your immune system strong during a pandemic. Throughout our dialogue, we want to hear from you, our viewers. So please feel free. We really welcome any questions or comments you might have. Just insert those into the comment section on whatever social media platform you're joining us tonight. And we will be recording this session, so it will be available to those who cannot join us. Certainly now, more than ever, it's important to keep our immune system strong. COVID-19 cases continue to rise across the country and in our communities at alarming rates. And we are seeing a record number of hospitalizations due to the virus. And many school districts who did open are converting to virtual learning. So tonight, our experts are going to address how you and your family can try and stay healthy through diet, physical activity, and stress management. And to get us started this evening, I invite each of our panelists to begin by introducing themselves and maybe sharing any observations they might have so far this school year. So if we could maybe begin with Dr. Christy Arts. You wouldn't mind beginning with an introduction. Thank you.
Hi, everyone. Welcome to our series. So excited to be here. I am an emergency physician and also a specialist in lifestyle medicine, which means I really focus on how we can help you stay healthy and well. I'm a mom of three children myself who are school age. So I'm thinking about all of these topics just like you are. How can I keep my family healthy? And I'm excited to talk to you tonight about different ways that food and other lifestyle habits can help us to do that. Thank you.
Dr. Ann Dudley, sorry. Oh, Ann, we can't hear you. We had to have that happen at least once this evening, right?
How about now?
We can hear you.
Great. I'm Ann Dudley. I'm an outpatient pediatrician at Southwestern Medical Clinic in Stevensville, Michigan, which is an affiliate of Spectrum Health. And I have 4 children myself, ages 8, 6, and then I have 4-year-old twins. So having 4 children in school, just like Dr. Arts, this school health is something that's really on my mind. I've been helping our school with the return to school policy. And I also have children and patients from all over our county who have concerns and questions about staying healthy during this time.
All right, can we go to Heidi Lineman next? Heidi, would you mind introducing yourself?
Yeah, hi everyone. I'm Heidi Lineman. I'm a registered dietitian and certified bariatric counselor, and I work at Spectrum Health Zeeland Community Hospital in the Community Relations Department, where I teach and I plan the community classes to promote healthy lifestyles and weight management. One of those programs is Fit and Healthy Families, where I teach elementary age kids and their families. And that's in the summer and in the fall. And this year, due to COVID, that's looked a lot different, and we had to do a virtual edition. So a lot of our classes have been affected where we have to hold virtual editions, but I think it's so important to continue to work on our health and to take care of our bodies, especially during what's all going on right now.
Great, thank you, Heidi. Next, Brooks Johnson, would you mind introducing yourself to everyone?
Hi, I'm Brooks Johnson, and I am an elementary physical education teacher at Mason County Central Schools up in Mason County near Ludington. My job is to teach the kids as much as I can. I used to teach a lot of skill-driven activities, but this year is very, very different in that I am also the only opportunity that our kids get to get out of their classrooms besides recess. With the impending winter weather coming on, the opportunities for them to get outside will get to be less and less, and it's obviously more important during these times to get them out more and to get more exercise to manage their stress as much as their families as well.
Great, thank you. And last, can we hear from Dr. Rosie Alavero, please?
Hi, good evening, everyone. My name is Rosie Alavero, and I'm a pediatric infectious diseases physician at Helen DeVos Children's, and I'm also a division chief here at the Children's Hospital. In my perspective about school health and COVID-19 comes from the standpoint, of course, being a physician in the field of pediatric infectious diseases, but like many of our panelists tonight, we're also expert parents, and I am a mom of 3 young children. And my children are aged 4, 6, and 8 years. And so this summer into fall, I've seen firsthand the amazing benefits of our children getting excellent education again. And for our family, that is an in-person education environment. But I have to say, I've also dealt with on a daily or multiple times a day basis the difficulty with educating our children and getting them to understand the way to go about their daily routine in a safe and healthy manner. And I can empathize a lot with parents as we're trying to navigate these uncertain times and trying to normalize our daily activities and our educational environments, but still with understanding that it's different and we need to really educate our children for how to keep themselves and others healthy. So I'm really excited to hear from our panelists tonight about the different ways to keep ourselves well, especially during the time of our really severe COVID pandemic.
Thank you. And I really appreciate the panelists kind of inserting some of their own personal experience this year around school health. So I'll share that I'm also a mom of 3 boys who are virtual learning full-time at home. I also, like Dr. Dudley, have twins who are 8, and I have a 12-year-old. So certainly a lot of the topics that we'll be discussing tonight, like how to keep meals and snacks healthy while the children are learning from home and getting physical activity and managing stress and screen time, all of those things are very real in my household as well as the other panelists described. So I'm definitely excited for us to jump in and talk about some of these really important health behaviors that can have such a strong connection to our immunity. But I thought it might be appropriate and relevant if Dr. Alavero, you wouldn't mind beginning by just maybe summarizing kind of our current state here in our community around COVID-19 and kind of maybe level set there, and then we can move on to some specific questions around health behaviors.
Yes, thank you so much. So if you've listened to the news at all lately, you undoubtedly know that we are indeed in the throes of a very severe COVID-19 surge in our community here in West Michigan, specifically in Kent County. There are far and away more COVID-19 cases in our community now in this moment compared to any other time in the course of the pandemic. And that might seem strange because back in March and April, we really had much more extreme stay in residence measures going on. So at that time, it might have felt like maybe there was more disease in the community. But as the pandemic has shifted out and as how some of the policies have changed in the state of Michigan, we're really in some ways doing some more normal activities, but in the midst of really very startlingly high rates of COVID-19 in our community. The rate of the rise of new cases of the novel coronavirus here in West Michigan is very, very rapid. And this concerns us that the new COVID diagnoses in our community, which could lead certain people to have to come into healthcare, could increase to the point that our local healthcare systems could become overwhelmed. So I have to say our medical community, not just at Spectrum Health, but in all of our community centers and across the state have really come very far in terms of diagnosing and treating COVID-19. And patients in general are faring much better compared to the spring of this year, meaning that fewer patients are staying in the hospital for a long time, fewer patients are getting onto the ventilator, fewer patients are dying. However, the sheer number of patients that are now infected with COVID-19 mean that we have a lot more COVID-19 patients in our local hospitals, both on the general floors and in the intensive care units. And what we, of course, worry about, we love taking care of patients and we accept all patients and we want to care for them as best as we absolutely can. But what we do fear is that if the rate of the rise of new patients gets to a critical mass, that we could get to the point of what we saw in Detroit and New York City and many other centers across the world, where the sheer number of patients that needed medical care in a hospital was greater than the capacity that was available locally. We do not want to get to that point, and we want our capacity to admit and care for patients to be really quite excellent, and we really want to provide outstanding care. So we really do not want to head to a dangerous situation like that. So I mentioned before that this might seem strange given the fact that we don't have such aggressive stay-in residence orders right now, but that's, in part because the prior emergency orders are not in place currently. So the responsibility of slowing down the spread of COVID-19 really comes to all of us in the community. It really comes to us to protect each other and keep our healthcare system fully functioning. So you may be wondering, where are all of these new cases of COVID-19 coming from? Well, the data shows us that our transmission events locally are actually from smaller gatherings, small social gatherings in restaurants or in homes. They're generally smaller groups, but in general, they're with people that are from different households who are letting down their guard and spending long periods of time indoor in close proximity without masks on. So it's really those interactions that we need to think very critically about, especially as we're turning indoors more and more and more. And really we need to think about that so that we can protect each other and protect ourselves and our community at large.
Thank you, Dr. Alavero. Really important information. So really appreciate that summary of current state and also the comparison to the spring or, late winter when the pandemic hit, and for sharing and reminding us of some of those really important measures we all really are encouraged to utilize and help slow the spread.
Thank you.
And so kind of, pivoting from there, but still really being focused on what we all can do to stay as healthy and well as possible and really build strong community. I'd love to turn to some of the other panelists and begin talking about some of these really key health behaviors like nutrition, physical activity, and hopefully we'll have time for stress management as well. So maybe we can begin with diet, just knowing what an important health behavior that is for overall health. And Dr. Arts, I'd love to begin with you. We know that eating healthy is something we all know is important. But maybe can you share a little bit and explain how our food choices actually impact our bodies and our immune system?
Absolutely, and I appreciate the question, and also hearing from Dr. Alavero all of the cases of COVID-19, but what we might do in our own homes becomes critically important to keeping our immune system healthy and robust and working very well when we potentially do become exposed to COVID-19 or even seasonal flu if we start to see that in our community. So I want to start with food is medicine. So if we all start with that concept in our heads, then we can start to think about, well, how do I bring in foods that are going to help to really boost my immune system, help to keep it strong and keep me healthy and my family and my children healthy during this period of time. So our bodies thrive on foods which are naturally high in nutrients and low in calories. And those happen to be a lot of our plant foods. And we call these foods nutrient-dense foods. What that means is that the foods themselves provide our bodies with key vitamins, minerals, antioxidants that help to strengthen and support our immune system. For example, when we're exposed to COVID-19 or other viruses like flu viruses, these foods help to reinforce our immune system as the first line of defense. They're like a little army in our body protecting us. They also help us to recover more quickly when we do happen to become ill. So eating foods like berries and green leafy vegetables, whole grains, beans, legumes, nuts, seeds, herbs, and spices are great choices to strengthen and reinforce your immune system. Lots of ways that you can do that at home, adding some berries on your cereal, maybe your oatmeal in the morning, maybe making a delicious vegetable soup that you can enjoy for dinner or for meals throughout the week. These are all critically important, and they're going to help to strengthen our immune system to keep us healthy and well throughout the season.
Great, thank you, Dr. Arts. Heidi, maybe we can turn to you and stay on the topic of nutrition and diet a little bit. From your introduction, learning that you do a lot of work with the community and with families, I'm sure you must hear during normal times that eating a balanced diet is challenging. And I'm imagining that you must be experiencing and hearing that families are finding it even more difficult during a pandemic to really eat a health forward diet. So anything that you can maybe share around some of those unique challenges that folks are facing during the pandemic and maybe how they can overcome those?
Yeah, so there's been so many changes and so many unknowns in all of our families, and we may feel a sense of lack of control. Well, one thing we can control is what foods we bring into our houses and what foods we choose to eat. So it's important during this time to start teaching your kids what foods are important because we may be spending more time at home. So start getting your kids part of getting that food to the table, part of food preparation. Maybe you can play restaurant with them, or if you have older kids, you can start to say, hey, this day of the week, you're in charge of planning the meals. And you can teach them the importance of having all different food groups in their meals. So we've all seen this plate, my plate, where half of our plate needs to be filled with fruits and vegetables. The reason for that is there's phytonutrients. So there's antioxidants, there's a lot of vitamins and nutrients with plants and vegetables, and they help ward off those bacteria and diseases and help with our memory too when it comes to school. A quarter of our plate needs to be filled with protein. So repair our muscles, we can build muscles along with dairy so that we also can keep strong bones and strong teeth. And then we have those grains, preferably whole grains, to give us energy so we can stay awake and learn well during this time. Now, along with teaching our kids, we also want to have that food readily available at our house. So remember to plan ahead to have all those foods on your grocery list and then to fill your pantry and cupboard and refrigerator with those healthy foods in all of the food groups. And then I like to just leave you and maybe your kids, if they're watching, with an analogy that's kind of fun for kids to kind of understand how important it is. So think of our bodies like a car or any engine that requires fuel. If we put the wrong kind of fuel in our cars or we water down that fuel, our car does not run efficiently. And if we do not get regular checks or oil changes or take care of our cars, then oftentimes the check engine light's going to go on, or it's going to lead to further more expensive problems in the long run. Well, same goes with our body. If we do not nourish our body with the right food, if we're eating a lot of Halloween candy and we're not eating those whole foods from all those food groups, then we're not going to feel as good. We're not going to have that good energy to concentrate in school. And our check engine light may go on, and we may be more susceptible to developing different diseases or different bacterias or flus that are going around right now. So make sure you fill your body and fill your house with those healthy foods and teach your kids the importance of them as well.
Heidi, thank you for that great information and the tips and the wonderful analogy. I'd like to just take a moment to thank all the viewers that are joining us live on a variety of social media platforms and just remind you that we welcome any of your questions. So please feel free to use the chat and enter some questions that we can pose to our panelists. Maybe we'll just stay on nutrition for one last question. And Dr. Ann Dudley, if you wouldn't mind chiming in with your background as a pediatrician, and maybe we can just talk a little bit more about why good food is good medicine, and really specifically about a little bit about the different nutritional needs for children compared to adults, since that's a population you spend a lot of your time working with.
Yes, that's a great question, and I love and I echo all of the things that the other panelists have said so far. They had so many good things to say. There are a lot of parents who ask me this question, and so I'm glad that it came up. What is the difference between what I eat and what my kids eat? And I think the thing that I want to make sure our viewers are aware of is that although in pediatrics we tend to say children are not small adults, meaning we can't treat them the same way with the same medicines or in the same philosophy for many things, in regards to food, we should feed our children what we want to eat, the healthy foods that we want to eat. I think sometimes we fall into the habit as parents of, if our kid says no to a certain meal or a certain food, that we think, well, then they must need kid food, foods that I know kids want to eat. So things like mac and cheese, hot dogs, hamburgers, pizza. And then it sort of becomes this cycle. So the thing about food as medicine, if it's good for us, we know that it is good for our children, with few exceptions. Children do need less calories when they're very small. For example, preschool age and under, they may need less calories, but that is a time that they also need higher fat. So although they may be eating less, we need to make sure that at every meal they have a healthy source of fat. So something like nuts, nut butters, olives, avocado, those are all great choices for healthy fat, especially for a young person whose brain is still growing and really needs that fat to help insulate their brain cells. Another thing that's different is that as we get older, so even young elementary school, they may be eating a little bit less than us, but something that I see is that parents think the 4-year-old will eat less than the 5-year-old, the 6-year-old, the 7-year-old. Really young childhood, a lot of times the meal sizes, the portion sizes are not that different. When we get to adolescence, that's the time that we need the most calories in our life, especially if we're very active. So that's a time that children will likely be eating more than the adults. And I think a lot of parents of teenagers can feel familiar with that, when it feels like your teenager is eating you out of house and home. So as our previous panelists have said, let's make sure that the foods that we have to offer are healthy foods that we know we should all be eating, and not necessarily kid food.
Thank you, Dr. Dudley. Great information, and certainly messages that resonate with me and even our household of young boys and nearing adolescence. We actually have a question from the chat, actually for you, Dr. Dudley, with asking if you have any specific recommendations that families should consider with the upcoming holiday season. I'm assuming that's around food choices and menus and some of those go-to recipes maybe that aren't as health forward.
Right. Yes, I have a lot of recipes because I work with Dr. Arts in the culinary medicine program, and I actually teach some of the residents at Helen DeVos Children's Hospital. I teach the pediatric residents culinary medicine. So we have a lot of recipes that we have developed, that Christy and her team has developed, and those are available right on the Spectrum Health website. If you search for the culinary medicine program, you can log on. They have a course coming up next week, and I'll actually be joining myself just to observe and to learn some of the new recipes that are on there. But there are many holiday specific recipes that are available. My family and my 4 children and my husband, we're all plant-based. So when we have holidays, we still like to have some of the same flavors that we were accustomed to and that we know and love as family favorites. But I think the thing to consider is that during the holidays, it sometimes feels like the whole month is a celebration. And I think then it kind of gets back into that same pattern where everything is a celebration. Every Friday is pizza night. Any kind of day is a day that we could celebrate. And there's food that goes along with that. And I think that something to remember during the holidays is that we need to be really careful about choosing when we're going to have a treat and what a treat means and what the portion size is for that. I think that's my biggest key for the holidays.
Great, thank you. And we definitely will, before the end tonight, include in the chat the links so that folks can navigate to our website if they're interested in recipes or classes. And I just have to share, since you kind of provided a prompt, that I am joining tonight from our teaching kitchen. And I had the pleasure when I arrived just a little bit ago that the team was trying out the holiday culinary medicine desserts. So I got to taste actually one of the new cookies on that menu for that class coming up. And it was certainly delicious and really hard to differentiate, but knowing that the ingredients were really health forward. So thank you for those tips. Yeah. So I know lots of discussion on diet and nutrition. It really is a critical health behavior, but we certainly can't ignore others, particularly physical activity and exercise, and knowing how important that is for everyone, but particularly children. So maybe Brooks, we can turn to you and your background as a physical education teacher, and maybe you can share with us, we certainly know that COVID-19 has impacted all of our routines, and for many of us, our exercise, and particularly we probably see that impact on our children as well. So, what advice do you have for families on how they and their children can stay active, even despite we're going into into winter with a pandemic on our hands?
Yeah, and going into winter in this side of the state is sometimes hard. I know being over by the lake, we get a lot of lake effect clouds, and we don't get a lot of sunshine in the winter this time of year. But it's still vitally important that you get outside. You get away from any screens, get away from the TV, get away from the computers, the phones, the whole works. Exercising as a family is even more important. If you can get out and get the whole family to come outside with you, it would be awesome. Going out for a walk, doing a scavenger hunt when the snow comes, building snowmen, building snow forts, even having snowball fights are great sources of exercise. We live in Michigan. Why not take advantage of the great outdoors that we do have, the parks that are around? Playing with your kids is super important in their developmental process as well. Playing catch with a kid can help them with their reading, with their writing, with their math. There are many things that go along with physical activity. We happen to be a face-to-face school district as of right now. We do offer an option of virtual learning, which our students, the way we have our virtual learning set up, our students get a break every hour to an hour and a half, at least a 10-minute break to get up and move. We find that a lot of our students at that point are done for a while anyway. They need that break to get up and move. The tough part about face-to-face at this point, at least as far as in an elementary building, is the fact that our students are in their classrooms for everything. They are in their classrooms for all of their specials except for physical education. They are allowed to come to my gym. Now, there's a lot of students in other school districts that are not. They can't leave their room. But families need to get out and exercise and play together. It is amazing what play does for our students and their academics. Just playing. Playing games, having dance parties. Indoors, you can do dance parties, put on some music, figure out different ways to move, use different locomotor skills. All of those things are fantastic for our students. I know there are a lot of families where people, and they primarily have these for adults, but have fitness trackers. If you're able to get a fitness tracker for your student, I will tell you that adding that technology piece, no matter what the age, really motivates students. I have heart rate monitors for my students, and they don't like instruction time because of it. With the time for instruction, that takes away from their movement, and they can see their heart rate up on a screen on the wall, and they know whether their heart rate is going up or down. And most of them, as soon as they see that heart rate coming down, they want to move. There's nothing wrong with that. Moving gets the oxygen flowing, gets their brain thinking better. Movement after a meal, taking a walk after a meal. Those are the kinds of things that our families and our students really do need. So getting out and playing with your kids is not a bad thing. It's a great thing.
Yeah. Well, thanks, Brooks. That really interesting to think too about how there's more challenges perhaps with in-person learning than virtual and incorporating physical activity. And as I shared, my 3 boys are doing virtual learning, and the 3rd graders, their virtual teacher's been great about dance parties, interrupting kind of the Zoom. And my 12-year-old is very active and often, using the basketball hoop in his bedroom in between classes. But certainly important, whether it's virtual or in person, as you mentioned, that we are as parents getting active with our kids. And I know for myself how sometimes at the end of a day, the last thing that my husband or I might want to do is my husband will go out to the driveway and play basketball with the boys or play ping pong in the basement. But knowing how important, and thank you for reminding us how important it is that not only we're active, but that we're engaging our children in that physical activity. I'd love to hit upon stress, another really important lifestyle risk, and was hoping maybe we can go back to Dr. Arts to weigh in a little bit about how does stress impact our bodies, and probably importantly as well, how can we manage it so that maybe we can combat some of those negative effects of stress, because right now we all have so much stress with the pandemic and everything else that goes along with that.
Yes, I agree. And certainly we all find ourselves under, a much different amount of stress over a longer period of time. Truly what we're seeing with COVID is that this is a marathon. it's not a sprint, to use our exercise analogies. And so we may find that we're under amounts of stress that we typically wouldn't have had in the past, and finding ways to better manage that is certainly going to be critically important. Stress can cause our immune system to not work as well, and therefore it can put us at increased risk of becoming sick from viral illnesses like seasonal flu or COVID, for example. Over time, stress can also cause inflammation throughout our body and raise our blood pressure. So in that scenario, over time, this can have damaging effects on our blood vessels throughout our body. It can even put us at risk for heart attacks or strokes as we age. Now, certainly we're not seeing those conditions in children at a young age typically, but stress over a long period of time can certainly put us at risk for developing those problems as we enter into adulthood. So a body under stress feels so much better when it gets exercise. I love what Brooks was mentioning as a health education instructor. And I really want to give a shout out to all of you who teach our children exercise and really highlight the importance of it, because it's just such a fabulous practice for all of us to develop and get involved with every single day. So when we're under stress, moving is one of the best things that we can do. Our bodies are truly made to move. So the act of moving the body can reduce stress and inflammation. It can even help lower our blood pressure. So next time you feel stressed or overwhelmed, try taking a 10-minute walk. Maybe I happen to have a dog in my house, and dogs are always great for a walk. They're always ready to get on the leash and go for a walk. And so that's another great way I encourage my daughters to get outside and get more physical activity. We've been lucky that they're involved in some activities that have continued, with swim, for example, and dance instruction. But I see that they're re-energized. They're better able to focus on their studies after they've had an opportunity to move their bodies and get their heart rate up, because this really is, again, just like food is medicine, exercise is medicine. So I challenge you, next time you feel stressed, get out there. Get out in nature if you can, go for that walk, maybe even just do some jumping jacks or a gentle stretch, and then see how you feel afterwards. And I imagine you'll feel more prepared to face the challenges that we all have ahead of us.
Well, thank you, Dr. Arts. Speaking of stress, one way that several families, many of us in the community, are feeling stress is when we are in need of quarantining. And I know we have a question in the comment about a whole family who had a quarantine, even when one family member had already recovered from COVID and was considered not contagious any longer. But we know that quarantine period lasts longer. So I know we're posting some helpful resources, or at least hopefully helpful resources, in the chat. But Brooks, maybe would you be able to offer any additional suggestions for families who are quarantining and how they can stay healthy? We have comments that folks are really appreciating your suggestion about a dance party. So any other suggestions for families who are quarantining and related to physical activity or other health behaviors?
I guess part of it is, in my opinion, when you're quarantining, it doesn't mean you can't walk out your front door. It just means that you shouldn't be around anyone else. You shouldn't go to a store or a populated area. If you have your mask with you, take that walk, get outdoors, take the dog for a walk, get out in the yard. But maybe have your mask with you so that if someone were to walk by your home, you would be able to put that on and to stay at least 6 feet away from anybody. But the importance of that stress relief of getting out of the house, I think we all felt it back in the beginning of all of this when we were home. I know I did as a teacher. I couldn't personally call my students because they didn't want students and families getting overwhelmed by getting called from their classroom teacher and other teachers during the whole shutdown. But one of the things that saved me was getting outside in my yard. I happen to have 3 dogs, taking dogs for a walk, even to the point where I would meet a friend to go for a walk, but one of us might be on one side of the road and one of us might be on the other side of the road. But during quarantine, it's probably even more important to get out of those same 4 walls, staying in that one spot continuously can be very depressing, and getting outside and getting some sunshine and some exercise would be a really good thing. There's also plenty of material on YouTube with meditation, yoga. There's lots of opportunity there to find workouts that you can do that are free from your home, and you can do as a family.
Yes, thank you, Brooks. Another kind of fun solution too for managing stress that my boys and family appreciate is Headspace, an app that you can download, and as a means to incorporate some stress management, mindfulness, and meditation, and really small tidbits that are also, they have a lot of modules tailored to children. It might be something fun to try as well, and trying to reduce overall stress and anxiety in the household. I was hoping maybe we can go back to Dr. Dudley for a minute and, reflecting on your work as a pediatrician and your work with families. What is, as you're seeing families, what is that one healthy habit that you really tell parents is essential during this pandemic? We know there are so many, we're hitting upon only some of them, but right, sleep, water consumption, there's so many things we need to do to keep ourselves healthy and well, and as, a strong immune system as possible. So yeah, how do you kind of help parents prioritize what's that one really key healthy habit they should be concentrating on?
That's a great question, because we all know that this is really hard. And as Dr. Arts said, it's lasting a long time. And as Dr. Alavero said, it's really bad. And so this can feel like a lot. And I feel that way myself as a mom and as a parent, as well. So I think that the thing that I really want to remind everyone, and what I try to tell my parents of children in my practice, is that we need to be consistent, but with grace. That would be the thing that I would recommend that we always do. So all of these health habits that we have outlined, eating healthfully together as a family without screens, looking in each other's eyes, being there, being present, exercising every day. And I want to echo what Brooks said, that it's great to get outside, get fresh air. We all need that. And, always trying to remember there's no bad weather. There's only bad clothing. So if we dress appropriately, hopefully we can get outside. Also remembering to get plenty of sleep. Children need 8 to 12 hours of sleep, sometimes more. Some teenagers get a lot less and they need a lot more. I think also keeping a consistent schedule just throughout the day, making sure that you're getting up around the same time, following a same schedule as you normally would, even if you're doing virtual school or if you're quarantined at home, trying to keep as consistent of a schedule as you can. And then a big thing is checking in with each other's mental health. And I know that we've touched on that, but I really want to emphasize how important that is. A lot of children are feeling very stressed. And I think as parents, we're feeling very stressed. So it may be easy to sort of, think that if they're quiet and they're acting happy, that it's probably okay, but it might not be. They might be having a lot of stress internally. So really making sure that we ask them. And if we're not sure, if we aren't sure if they're okay, or if they're showing us signs that they're not, that we ask for help from our physician or other healthcare provider. So I think the biggest thing I would say is be consistent. It's easy to sort of slip into a pattern of letting some of these things go, but as much as we can, be consistent, knowing that this could be for a very long time, but that we can do it. We have the strength, we have the ability. And if we need help, ask, because so many of us are available and want to help.
Yeah. Thank you, Dr. Dudley. And I know in my background as a health psychologist and behavioral scientist, I really appreciate many of the sentiments, or all of the sentiments you shared. And I think too, we often get concerned from folks that they just don't know where to begin, whether that is like starting a new health behavior or trying to get back on track, like you said. And so I always, and I know you shared these sentiments as well, as starting small, right? Like just
Right.
start somewhere, and don't feel like you have to do it all at once, but oftentimes starting small, starting specific, allows you to get some really quick wins, that then not only builds confidence, but skills to then tackle some of those bigger, maybe more challenging health behaviors. So yeah, thank you for
Absolutely.
sharing. I thought just given some of the comments and questions that are coming in, but also we get often is wondering if Dr. Alavero, we can go back to you and maybe you can just talk a little bit and explain a little bit the difference between isolation and quarantine, because certainly we know quarantine is a concern on how can we really keep ourselves well mentally and physically if we are in quarantine. So can you share just a little bit about that distinction between isolation and in quarantine?
Yeah, absolutely. And this is a very common question that we get, and one that is very easy to get confused. So the first term is isolation, which when we're talking about infections, or in this specific case, COVID-19, self-isolation means that you are infected with the novel coronavirus. You've been found to have a test positive, or the doctor that you see wasn't able to do a test, but they think that your clinical symptoms fit the picture for COVID-19. So you're deemed to be infected. And during that period in time, you really want to minimize or prevent completely the spread of the virus to anybody else within your household and within the community. So what you have is a period of self-isolation where you take yourself out of the community, you isolate yourself because you are positive with the virus. There's a risk that you will spread it to other people. And so you stay in your home. You don't use any other shared objects with other people. You avoid kissing, hugging, using the cups and utensils, and wearing a mask at all time, especially if you're around other people. So that is actually different than quarantine, which means that you have been a close contact of somebody who was found to have COVID-19, and you now are then taking yourself out of society and quarantining yourself for a period of 14 days and monitoring for signs and symptoms of COVID-19. So I think one of the reasons it gets really confusing for people is not only the terminology, but because isolation or self-isolation when you are infected with COVID-19 lasts about 10 days from when your symptoms started, assuming that by the 10th day, your fevers are gone, you're feeling better, you're no longer having active symptoms. However, as we all know, quarantine lasts for 14 days. So you may wonder, well, why am I quarantining longer than somebody who actually has COVID-19? And that's because the range of time that people develop symptoms of COVID-19 after an exposure is highly variable. It can be as short as 4 or 5 days or as long as 12 to 14 days. So that's why that period of quarantine is 14 days long. And I know it is difficult and it can be really challenging, especially if you have a lot of other people in your household, but we really encourage folks to isolate themselves as much as possible and prevent the spread, and certainly to not spread it outside of the household.
Great. Thank you, Dr. Alavero. I know we have just a few moments remaining. Heidi, I was wondering if maybe we can go back to you. And I always appreciate when there's a chance for some of those final take-home tips and points that maybe the viewers can, bring into their life this evening or even tomorrow. Can you maybe share with us some of your top recommendations for foods to really try to incorporate, whether, again, we're sending our children off to school or feeding them throughout the day at home with virtual learning?
Yeah, so as a mom of 3 myself, I never realized how creative I have to be to get my kids to eat certain foods. So as I said, we want to model the plate method, but we also want to make sure our plates and our lunches that we're packing are super colorful so they get all those different nutrients and vitamins that we need to fight off this virus during this pandemic. So I wanted to provide you with some resources that if you're kind of getting bored 3 months into school, whether you're at home or whether you're packing lunches, you're getting bored with your lunch ideas, I want to give you the opportunity to have some ideas. So I have a handout that's attached and it's called What's on Your Menu, and it has 12 different ideas of what you can pack for your kids' lunches. Well, what you can pack, I do not necessarily mean, but what your kids can pack for your lunch. So show them that sheet. Show them some options. Grains does not just have to be whole grain bread. It can be crackers. It can be pasta. We can have lots of different protein, eggs, hummus, beans. So show them the options. And there's also another handout, what snacks count. And there's a lot of different snack ideas because we want snacks to fill in those nutritional gaps. And do not forget to pack that water bottle or have that water available at home, because water can help flush out your system and detoxify and decrease that inflammation. So get your kids involved and utilize those handouts for extra tips.
Great. Thank you, Heidi. Well, I'd like to now take the opportunity to thank all of our panelists for all of the tremendous information and time they were willing to dedicate to share with us this evening. And to thank you all from at home for joining tonight and viewing and sharing in this fourth Spectrum Health School Health virtual series. We have recorded the session, so it will be available for folks to watch after this evening. And just want to thank everyone and say good night.